Good day and welcome back to my channel. On this video, we will be understanding BRCA, simplifying the tricky ins and outs of inheriting the fault breast cancer gene. Some people might know of it as the Angelina Jolie gene, after the star went public with her diagnosis, but the faulty breast cancer gene, BRCA, remains largely unknown and misunderstood. Perhaps due to its name, mutations and variants of BRCA are primarily associated with increased cancer risks in women. However, as a recent Emmerdale storyline has helped highlight, the complicated genetic variant also has possible cancerous effects in men. Here, with the help of Cancer Research UK and Breast Cancer Now, we explain what it is and what inheriting it might mean for you. What is BRCA? Every human, male and female, possesses the breast cancer gene, BRCA, also referred to as BRCA1 and BRCA2. These genes are vital within our DNA, stop our cells from dividing and growing out of control, and are often referred to as tumor suppressors. However, these genes can be faulty or mutate, therefore encouraging our cells to grow rapidly, which can lead to cancer developing in those that are positive for the mutation. As we inherit DNA, the faulty version of the gene is passed down from our parents from birth. A child conceived from a BRCA-positive parent, male or female, has a 50% chance of receiving the same mutated gene. It's reported that families from ethnic backgrounds are more likely to carry the gene. It's particularly prominent in those of the Jewish community, who are 6 times more likely to carry faults in BRCA genes than the general population. Eastern European families are also at a greater risk. A positive BRCA mutation diagnosis increases the risk of more than one cancer type in both men and women. These increased risks are associated with breast, ovarian, prostate and pancreatic cancers across both genders. Cancer Research UK reports that women who are confirmed to have the faulty BRCA1 or BRCA2 gene have a 70% chance of developing breast cancer by the age of 80. This compares to the lifetime risk of around 15% in the general population. Women with the BRCA1 mutation are at a 65% higher risk of developing ovarian cancer compared to those with normal functioning DNA. For men, the BRCA2 variation of the gene is reported to carry a higher than average risk of breast cancer, at 10 in every 100. Risks of pancreatic and prostate cancer are much lower than breast or ovarian cancer, with a stronger focus on the effects for the DNA in women. It's important to note that most cancers are not linked to inherited faulty genes, and those with the faulty BRCA genes do not always develop cancer. Specialist cancer nurse, Caroline Garrity at Cancer Research UK shares, most cancers are not associated with mutated genes and only around 5 to 10% are linked to a faulty gene. While the faulty BRCA1 and BRCA2 genes might be hard to wrap your head around, predictive genetics testing for the diagnosis is straightforward via a simple blood test. To be eligible for genetics testing via the NHS, there needs to be a strong history of cancer within your family, or the faulty gene must already have been identified in a relative. Due to the greater risks within Jewish families, genetic testing is available to those 18 and over who have one or more Jewish grandparents. Private tests outside of the NHS are also available if you do not meet the criteria, with tests starting from £1,000 per person. Unlike a standard blood test, the turnaround time for results is lengthy, usually with a 6 to 8 week wait. It is important to know that BRCA genetic testing is not mandatory. Patients will be required to discuss the test thoroughly with their GP or genetics counselor prior to the blood test, to ensure this is the best course of action for them. The uncertainty of a higher cancer risk can be unsettling for some, and it's important to have a support network of family and friends. Following a positive diagnosis for either variant, patients are fully supported via knowledgeable genetics specialists on next steps and possible screening options that are available, depending on the cancer risk. The NHS currently offers those over 50 low-dose X-rays, otherwise known as mammograms, that typically take place every 3 years. Following a faulty BRCA diagnosis, breast screening can begin at the age of 35, and those diagnosed under this age are advised to look out for telltale signs of breast cancer including, but not limited to, lumps, dimpling and discharge. Speaking on BRCA testing, Baroness Delif Morgan, chief executive of Breast Cancer Now says, crucially, identifying more people at increased risk of breast cancer due to the BRCA gene alterations will help empower them with the knowledge and opportunity to take action to reduce their risk of developing the disease and increase the chances of an early diagnosis. Despite the increased risk of ovarian cancer for BRCA-positive patients, in the UK, screening is not currently offered to patients, as tests cannot find ovarian cancer early enough. The main symptoms of ovarian cancer include bloating, tenderness in the tummy or pelvic region, lack of appetite, and increased urination and urgency for the bathroom. Whilst faulty BRCA genes do not always result in cancer, some women with BRCA1 or 2 opt to have risk-reducing preventative surgery. This is a personal choice and will be discussed thoroughly with healthcare professionals. In 2013, following a positive BRCA1 diagnosis, actress Angelina Jolie underwent preventative risk-reducing breast surgery, bilateral mastectomy, and reconstruction, which lowers cancer risks by 95% by removing most of the breast tissue. New breasts are constructed by using tissue from another part of the body, including belly, back and legs, or by using breast implants, and the best option will be discussed with a surgeon. Before starting a family, BRCA-positive parents may be offered pre-implantation genetic diagnosis, PGD, to ensure their child is not born with the faulty gene and therefore does not continue to pass this on to future generations. Lifetime risk of around 15% in the general population. Women with the BRCA1 mutation are at a 65% higher risk of developing ovarian cancer compared to those with normal functioning DNA. For men, the BRCA2 variation of the gene is reported to carry a higher than average risk of breast cancer, at 10 in every 100. Risks of pancreatic and prostate cancer are much lower than breast or ovarian cancer, with a stronger focus on the effects for the DNA in women. It's important to note that most cancers are not linked to inherited faulty genes, and those with the faulty BRCA genes do not always on the completion of a family. A risk-reducing bilateral salpingo-oophorectomy surgery will remove a woman's ovaries and fallopian tubes to reduce the risk of possible ovarian cancer. Thank you for watching. Remember, there is always hope if we look after our health by staying healthy and an early detection.